But what is really exciting me at the moment is the long-term results of the cases that I'm seeing. This is a patient that I saw, Brenda. She came to see me when she was 63. Her treatment took about 6 weeks to do. And 9 years later, she's looking better than when she first came to see me. I'll come back to her case later on and we'll look at it in a little bit more detail. But let me just explain the two procedures that I'm doing at the moment. The dental facelift and Oralift facial rejuvenation. The dental facelift involves increasing lower facial height permanently. That's the distance between the tip of the nose and the chin. This can be quite an invasive procedure if all the teeth in the mouth have to be crowned. But for people who've got dentures, this is a fairly simple procedure. All edentulous patients, if they are wanting to improve their facial features, should be having this treatment first, not going to the cosmetic surgeon. This is quite important. The occlusal vertical dimension is the dimension of the face when the lips are held together and the teeth are touching in centric occlusion. The Oralift treatment does not increase the OVD, that is the way the teeth meet together, but it can increase the resting vertical dimension. Now, the difference between occlusal vertical dimension and the resting vertical dimension is that at resting vertical dimension, the lips are held together, but the jaw is allowed to rest in its normal position. And at this point, there's a space between the top teeth and the bottom teeth, and that's called the freeway space. The Oralift treatment can alter the freeway space, but not the occlusal vertical dimension. Therefore, it is completely a non-invasive form of treatment. Some of my work has been published in the British Dental Journal. My first paper was published in 1996. It took about 4 years to get published. The findings of that paper were that we could change lower facial height by up to 19 millimeters at a time in edentulous patients. Up to now, the current thinking had been that you should not change lower facial height, or if you are going to change lower facial height, it should be done up to the maximum of about 3 millimeters, and you should not go beyond the resting vertical height. This paper showed that you could do both. You could go beyond the resting vertical dimension and at the same time go to much larger figures. We were doing 19 millimeters all in one go. Because the paper was so revolutionary, that's why it took about 4 years to get published, because I had to work with a consultant from King's College Dental Hospital here to come and look at my patients, and the whole process took a long time. The next paper I published was in 2002, and this time the paper took only about 6 months to get published, because by this time the referees had known my work. What this paper showed was that when we increase the lower facial height by the amounts that I was suggesting, the technique that I was using to determine how much to increase the vertical dimension was what I call a command swallow position. When we increase the lower facial height by these amounts, the patients looked between 5 and 20 years younger. The patient who looked 20 years younger, I'll show you his picture later on. But the interesting thing was that the improvement was not confined, as I said, to the perioral area, but people said their eyes looked better, their noses looked better. Even they reported improvement in neck. What we are going to do today is going to look at case histories of the two procedures, the dental facelift and the Oralift. The reason why I want to keep them separate is because here we are increasing the occlusal vertical dimension permanently, as I said, whereas with the Oralift we are not. You can see the improvement in the face. The lips look much fuller. The eyes look much brighter. The cheeks look higher. The improvement in the facial shape, which is the most important thing here, is now in golden proportion. The golden proportion is a ratio that occurs in nature, and it's a ratio of 1.618 to 1. It occurs in the rhythm of a heartbeat, in the design of a leaf, design of a flower. Even in architecture and design of cars, you'll find this ratio occurring all the time. We have a caliper that opens in that ratio of 1.618, and that's the caliper you're seeing in these pictures, which you can use to measure whether you've got the right proportions. On the face, the distance between the hairline and the nose and the chin has to be in that proportion. The distance between the eyes and the corner of the lips has to be in the same proportion as the lips and the chin. When I'm restoring faces, I don't use my golden proportion caliper and make sure that I've got the right proportions. At the end of the day, rules are there only, well, this is I find out from experience, rules are only there as a guideline. We mustn't become slaves to rules. And therefore, I use personal judgment. From the side, when we are restoring faces, I use the Ricketts plane, which is the line between the tip of the nose and the chin. The upper lip should be 4 millimeters away from the Ricketts line, and the lower 2 millimeters. If we now look at Lisa's pictures, the ones we just looked at, you can see that before treatment, her face was not in golden proportion. The distance between the nose and the chin is far too small compared to the distance between the hairline and the nose. After treatment, golden proportion has been restored to the patient's face. The golden proportion can also be restored. In dentistry, we haven't been taught that we should increase lower facial height to improve facial shape or to restore to the golden proportion. The reasons why we have increased lower facial height are these these first three reasons. The first one being to create more interocclusal space. Sometimes the jaws are so close together that if you want to put implants in, you find that there isn't enough room to put crowns on top of those implants. Therefore, you need to increase the lower facial height, and dentists will do that. Sometimes the teeth are very worn down, and you can't crown them. Therefore, you need to increase lower facial height. And some people have used to increase lower facial height to improve signs of TMD symptoms, but I don't think I would do that. The last two are the reasons why I'm increasing lower facial height. That is for the restoring facial aesthetics and for the anti-aging effect. The anti-aging effect is the long-term results that we are seeing.